Let's discuss about the algorithm for the management of acute vomiting. Okay, uh, first of all, we have to take the medical history. Medical history is most important. Okay, it draws, it takes us to the different etiology. Okay, and then after that we have to do basic blood test. Okay, and if we think the patient needs acute supportive management, like if you think the patient is dehydrated, okay, if there is hypotension, electrolyte imbalance might be there, okay, during initial blood investigation, then you have to do emergency management. At first you have to give fluids, okay, to the patient and try to correct electrolyte imbalance. After that, if you do not think the patient needs acute supportive management, then if the patient is female, okay, if the patient is female, always rule out pregnancy. Okay, and if the patient is not female or you have a rule out pregnancy, then if you think the patient is having GI obstruction, then immediately send for plain x-ray. Okay, and cross-sectional imaging is also important sometimes, okay, to find out specific cause of the obstruction. After that, if the patient is having obstruction, then you have to give specific treatment for the obstruction. Okay, and if their patient is not having obstruction too, then it is now categorized into few of the differential diagnosis. Okay, if the patient is under chemotherapy or radiation therapy or there is recent surgery, then you have to give a symptomatic treatment. This chemotherapy might cause vomiting. Okay, radiotherapy might cause vomiting, and if there is recent surgery, then that might also cause vomiting. Okay, symptomatic management with antiemetics and sometimes glucocorticoid might also be needed in this case. Okay, after that, if you think GI or any other systemic infection, okay, you have to repeat history also. Okay, sometimes you have to take history again. Okay, you have to take history again and find out if the history is suggestive of any type of GI or any systemic infections, like, then you have to treat that infection. You have to find out which infection can be there and you have to treat that. Okay, and along with that you can give antiemetics as well. Okay, if you think there are certain drugs, okay, or toxin which might have caused the symptoms, then you have to remove that offending drug. Okay, offending drug, and give antidotes of that drug as well as antiemetics. Then the vomiting will be stopped. These drugs can cause, the drugs causing vomiting can be any aspirin, NSAID, anti-diabetic drug, okay, anti-gout drugs like febuxostat, antimicrobials like acyclovir, anti-tuberculosis drug. Any of these drugs can cause vomiting. Okay, and cardiovascular and anti-anemic, antihypertensive. You have, there are many list of drug. Okay, lipodopa, carbidopa, okay, azathioprine, sulfasalazine, oral contraceptives even can cause vomiting. Theophylline causes vomiting. Okay, if you think these are the cause of vomiting, if you have just started this drug, if there is just started, you have just started this drug, and if the patient started vomiting, then you must review this drug and sometime may stop for a certain time to know if this drug has caused vomiting or not. Okay, if you think there is neurological or vestibular causes manifestation are there, then you have to order CT, MRI, okay, to rule out any intracranial lesion or intracranial infection or like that. ENT evaluation for vestibulitis, okay, BPV can cause vomiting. Okay, you have to do a specific neurologic examination and treatment. And if there is electrolyte imbalance and glucose imbalance, then you have to check that and correct this. Okay, adrenal insufficiency can cause vomiting, and you have to check for this and treat with glucocorticoid if needed. Okay, if there is, you cannot find any clues till now, then you have to investigate for a motility disorder. Okay, motility disorder can cause vomiting, and although this is less common, other less common causes also you have to think for. Okay, now we'll go towards what can be the causes of vomiting. Okay, causes of vomiting. Okay, what are the principal causes of vomiting? Well, will there can be due to abdominal causes like mechanical obstruction, like gastric outlet obstruction. Okay, there can be motility disorders. Okay, intra-abdominal causes like appendicitis, cholecystitis, acute hepatitis, mesenteric ischemia, Crohn's disease. Okay, any sort of intra-abdominal infection can cause vomiting. Okay, drugs I have just discussed about infections like acute gastroenteritis, viral or bacterial or any other systemic infection can cause vomiting. Okay, if the metabolic or endocrine disease like acute intermittent porphyria, Addison's disease, DKE, diabetes mellitus, hyperthyroidism, hyponatremia, hypoparathyroidism, and pregnancy can cause vomiting. Okay, nervous system disorders, and there are other less common diseases like anxiety and depression, cannabinoid hyperemesis syndrome. Okay, there can be cardiac disease, and although this is rare cause of vomiting. Okay, heart failure patient rarely presents with vomiting. Okay, there are less common causes, but the patient might come with this vomiting, only vomiting as a symptom as well. Thank you. This much for today.